Good afternoon. In bargaining with the Health Sciences Association of Alberta, the UCP is proposing to roll back the wages of frontline healthcare workers and social workers. It is a new attack from the UCP in their war on healthcare and social services. They have fought nurses and doctors, and now they're trying to slash the wages of many others. I am particularly concerned about the proposed 11% cut to social workers. We are in the midst of a substance use and mental health crisis in Alberta. The UCP claims to be concerned about this, and yet they want to roll back the wages and the pay of Albertans struggling on the front lines in this crisis. As a registered social worker myself of more than 30 years, I can tell you that my colleagues are in critical need to help Albertans struggling with substance use and mental health challenges. What's more, Alberta is struggling with increasing poverty and homelessness, which requires social workers to help people access the services they need. Social workers have done incredible work throughout the pandemic, and the government should be thanking them, not slashing their wages. Meanwhile, the UCP are planning to hand over 20 to 40% wage increases to the executives of AIMCO. It was not executives who helped the most vulnerable throughout the pandemic. It was social workers and all the health workers whose wages the UCP are planning to cut. This is yet another reason why Albertans can't trust the UCP to manage the health crisis, substance use and mental health crisis, or anything else for that matter. Thank you, and I'll pass this on to my colleague David Shepherd.
Well, thank you, Laurie. I echo Laurie's comments that this is a brutal insult to all Albertans who have put themselves in harm's way throughout this pandemic and who've been working to protect their fellow Albertans for their entire careers. Respiratory therapists, paramedics, lab technicians, so many others. They are heroes, and their work isn't done. They continue to step up under significant pressure to support the health and save the lives of Albertans as we recover from the COVID-19 pandemic. But the UCP wants to slash their wages at the same time as they want to hand massive raises to executives at AIMCO. I don't think that's going to pass the smell test for any Albertans. So as Laurie said, Albertans simply can't trust the UCP to do what's right or protect our public health care system. With that, we'd be happy to take any questions.
So I suspect that from what I'm hearing, the government's argument is essentially that we have to get wages in line with other jurisdictions like Ontario. So the rollbacks they're proposing reportedly would line us better up with other jurisdictions. What do you say to that?
Well, I think we need to recognize that Albertans have been facing a lot of challenges. Let's remember, all of these workers are facing the same challenges as everyone else in terms of rising utility costs, rising fuel costs, inflation. And these are workers who have not seen any change in their income in some cases for about a decade. So this government really needs to think about where its priorities lie. It's certainly, again, happy to give these raises to executives at AIMCO. But these frontline healthcare workers, the folks that we need to help us recover the level of deferred care that I'm hearing about from healthcare workers in our hospitals, in our clinics. This is going to take a strong workforce to support. And if we are going about cutting their wages in the wake of this pandemic, that is going to drive more of them away at a time when we already have a critical staffing shortage. So I think it's incredibly short-sighted for the government to be trying to balance their budget on their backs.
I do want to get, Evan, what is the staff shortage when it comes to the social worker side? Are you hearing concerns about the number of people working in those positions, recruiting and retaining these workers as it is?
Yes, for sure. I mean, it is always an issue, and it's so stressful right now with the opioid crisis and all the demands during the pandemic. And so there is a lot of difficulty. I mean, social work isn't a high-paying job. And to think that the government is going to slash their wages by 11%, I mean, they're not going to have enough people to support vulnerable Albertans who need their help. And, there's so many programs the UCP have cut already, and guess what? Social workers are the ones who help people navigate those programs, so they have extra work. And on this, now, their wages are going to be cut. It's demoralizing for frontline staff. So certainly many are stepping away.
take away from these numbers, these proposed rollbacks? If this is a starting position, for example, in negotiations, I mean, obviously, the employer side is going to start at one end and then the employee side at the other, and eventually they'll presumably meet in the middle. So isn't it reasonable to expect that they're a little extreme of the original proposal side of things?
Well, I just want to say, in that list that we've all seen of all those numbers, social work is at the top, the highest one. So why is that? I mean, it seems to me the UCP are not respecting the profession, just like they haven't respected doctors and nurses during this pandemic. They seem to not care. So regardless of that, they seem to, not value these types of services. And I find it heartbreaking and frankly very appalling that UCP continue to attack professionals who are the ones who have helped us through the pandemic and supported vulnerable Albertans.
I lied, I have another one. Why do you think they're cherry-picking professions for the rollbacks? Are they trying to pit one profession against the other? Are they trying to create some sort of animosity? Or what in your mind is the motivation behind, rather than doing like a blanket, rollback across the...
Well, I'm not part of their caucus, but certainly it seems to me what they value, what's important. And so they're not valuing social workers. They're saying they, most of all, need to take the most significant cut. So I would just say what they think is important, whereas, they really think the financial people who work at AIMCO should get, exorbitant salaries. So it's really about values.
Hello, Jen French from the CBC. I am curious for David, if you could tell me how these proposed cuts to line will be student government about bolstering Alberta's healthcare system. They have repeatedly said that the healthcare system was not fully equipped to manage this pandemic.
I'm sorry, Janet. I just lost the middle part of your question. Could you just repeat that for me?
Sorry, how am I now?
Good.
Good, okay. I just wondered if you could speak to how you think these proposed wage cuts for particularly respiratory therapists and specialized healthcare workers align with the government messaging about bolstering the healthcare system to deal with future waves of the pandemic.
It's quite clear that this government is not following through on its promise. Jason Kenney signed his big piece of chloroplast saying that he would support the public health care system, yet at every turn he chooses to undermine it throughout the pandemic and even now as we're coming out of it. Indeed, I'm going to have a number of questions, I think, for Minister Copping at Estimates tomorrow about what their plan is for addressing deferred care coming out of the pandemic, not to mention, as he said, potential future waves. Indeed, we know that we are going to need our respiratory therapists, speech-language pathologists, right, who indeed I read today that one speech-language pathologist was talking about how 30% of her current caseload is people who are having problems due to swallowing from long COVID. So what we see from this government, I think, is once again putting their political interests ahead of our best interests in public health, in looking to make these cuts, in looking to save a dime so that they can try to claim that they are good fiscal stewards, while at the same time creating, I think, a lot greater need, undermining our healthcare system and our ability to respond to the care that's needed.
We do not. Thank you.
Hi there, Terry Fikowski from CTV Calgary. Thanks for taking my question. I'm just wondering if you can touch on any concerns with the government.
Sorry, we seem to have lost you there. Any concerns with the government?
Oh, sorry about that. Just about comparing wages to those Ontario West, saying that they're making more than their competitors in places like Ontario.
So again, we have seen clearly this government is not afraid to spend money where it thinks it's going to help their interests. Their $1.5 billion gamble on the KXL pipeline, which did not succeed, was lost to Albertans, and now the Premier is musing about doing it again because it suits his political interests. And then, of course, we see these raises for AIMCO employees. So this is not about a government that's a good fiscal steward and trying to make good choices. And you note that wages are higher here than in Ontario. Well, the fact is we are in an incredibly competitive market right now for healthcare workers. We are critically short-staffed in this province. We have a government that claims they're going to double surgeries in private facilities. They claim they are going to expand ICU by 100 beds. All of that work requires frontline healthcare workers that other jurisdictions are putting forward incentives and raising wages to attract. So if Alberta wants to be able to follow through and support our public healthcare system, slashing the wages of the very workers we need is not going to get us there.
No, thank you.
Any other questions on the floor? No? We'll go for one more pass on the phone. Over to star 9 if you're on the phone. Raise your hand if you're on Zoom. Join us if your hand is up. I'll see if you want to chat.
Sorry, I should have taken my hand down.
Okay, thank you. Okay. Seeing no more questions, that ends the Thank you.
Thank you.
Tens of thousands of Albertans have already provided their idea for how we can build Alberta's future. You can too by going to albertasfuture.ca.